retained placenta. And I said that a retained placenta is a placenta that is not delivered 30 minutes after the delivery of the baby. Okay? Now, yesterday I was called to go and remove a retained placenta. And I know it's not my job. And because most people did not teach you that retained placenta. So, Nomos, how do we remove a retained placenta? Assuming you came and the placenta is retained, what will you do? You call the doctor.
You first do manual evacuation.
Yes, you try manual evacuation. But before you do manual evacuation, the moment the baby comes out, you can give oxytocin. You can give ergometrin. We want this uterus to contract and naturally push out this placenta. Because that placenta that the womb itself pushes out is less painful and less likely to have retained product of conception. It's two different things. So retained placenta and retained product of conception. In retained placenta, the placenta is there. In retained product of conception, the placenta has come out, but some of it detach and remain inside and can cause bleeding. So the moment the woman delivers, the next thing to do is to look around. Is this uterus contracted or not? If it's contracted, sometimes you can squeeze. Sometimes, if it's not contracted, perhaps you can give oxytocin. You can give other things. But there's another thing, but that is for people in the village. If the uterus is not contracted and there is no oxytocin anywhere, there is no drug anywhere, sometimes you will tell the woman to bring the baby so that the baby will suck on the nipple of the woman. If the baby tries to suck on the nipple of the woman, it can expel the placenta. It can even stop bleeding. I don't know if you understand. If the baby cannot suck, sometimes tickling the nipple can help. Because by the time you tickle the nipple, you release normal oxytocin. I don't even understand. Those natural ones can be big enough to fight to expel the placenta. That is when you must have done all this before you start talking about manual removal. In fact, what happened yesterday was that it was removed manually. But there are some extreme conditions where the woman must have finished delivery that you have to do CS to remove the placenta. In the case of placenta acrasia. And there are things that makes it possible. If you look at a woman, find that this person is a keloid former, he forms keloid, there is possibility that she might have retained placenta. I'm not saying all keloid former have placenta, but these are the factors that makes it more likely to have a retained placenta than the other. I don't know if you understand, but usually we can go to oxytocin, we can even go to misoprostol. We go to all this level before we will now say that, because those ones, some women are not cooperative. They will not allow. So those are the things you have in retained placenta. And it's the same way that you can address bleeding.